Hi, everybody. Dr. Joan Ifland here. Today, we are going to open some amazing doors for you. You are going to understand why you have chronic diseases and exactly what to do about it. We're going to be tying together 20 chronic illnesses and showing you how they are all related to processed foods. And this is really fun because when you get off the processed foods, you think, oh, well, I'm just going to lose some weight or whatever. But then all these other great things start happening. And I just want you to know that they are real. There's a reason why this huge range of great things start happening. Diseases just get better, and things that you were told are incurable, or you're going to have them for the rest of your life, or you have to be medicated for them. And then you find out that that's not true. Well, I'm going to give you the reason why today. You're going to see why so many things get better. Knowledge paves the way, and our industry is profiting from us being sick all the time, and they don't want us to know this information that I'm about to give you. But when you find out why you're sick and you find out exactly what to do about it, yes, life is good. All right. So we do want to immediately start connecting the dots. Americans eat 73% of their food in processed foods, and 93% of Americans have a diet-related diagnosis. So 73% of food in processed foods, 93% of people have a diagnosis. They either have high triglycerides, blood pressure, blood glucose, obesity, and this led to 1.7 million Americans dying from a diet-related disease in 2020. This is an epidemic, and it's really serious. So I'm really excited that you're here and that you're going to find a way out of it. Why is there so much chronic disease? How are processed foods, weakened cells, chronic illness, and medical industry profits, how are they connected? So here's your first big clue. Processed foods weaken cell function. Now, I have a whole nother video on this, and you're welcome to write to us at info@processed-food-addiction for any of the videos that I mention. And we have a whole video on how processed foods, they really attack cell function. So you start there. Processed foods are making my cells not work very well. Weakened cells weaken essential systems in the body and brain. So when you have weak cell function, you don't have good inflammation control, glucose, look at this slide. Stop and pause here if you want to see the rest of the slide. But of course, all the systems in your body, they depend on their parts working for the system to work. If your cells are weak, your system is weak. And then weakened cells combine to develop chronic diseases. Now, here are the 20 diseases that we're going to be looking at today. I'm going to fly through this. I'm not going to hold you up, but just stop, pause the video if you want to read one of these slides about one of these diseases. What are we going to be doing? We're going to be showing you that all of these 20 diseases have common sources, and it's weak cell function. Okay, so why isn't your doctor talking to you about this? Well, in 2022, the U.S. medical industry had revenues of $4.5 trillion, profits of $583 billion. And guess what? 90% of those revenues came from chronic illnesses, the very illnesses that we're going to be looking at today. So how does this pan out? Well, it's not hard to see that the medical industry depends on keeping us chronically ill from processed foods. A plus B equals C. So here are the 5 pathways that I really want to focus on today. When processed foods attack cells, the body responds by trying to protect the cell with inflammation. So we're going to see inflammation come up again and again and again in the reason why we are experiencing chronic illness. Processed foods destabilize blood glucose. It's either too high, and then you're getting an insulin release, or it's too low, and you're getting an adrenaline release. And that is just devastating. You're going to see that come up again and again, because when your blood glucose is high chronically, your blood becomes thick, and that causes a lot of problems in the body. Like, you wouldn't be able to tell that your blood is thick just from looking at it, but your body knows that it's too thick to push through the body. So normalized brain firing. We have really intense cravings from what the tobacco food industry has given us, and it's disrupting the brain firing throughout our brain. There's too much cravings, there's too much activity in the pleasure pathways, and not enough activity in the thinking brain, the control brain, the front of the brain. We are having trouble regulating hormones because the adrenal glands are constantly correcting blood glucose crashes, but they're supposed to be regulating hormones. And then we have a big problem with nourishment because processed foods are not nourishing. We're going to look at the pathway, how do processed foods create the disease. We're going to look at the pathway for how to put the disease into remission by eliminating processed foods, what happens. And then we're also going to find out why the medical industry is not telling us about this. Okay, let's start with these 4: diabetes, hypertension, obesity, and sleep disturbances. Diabetes is because of processed foods, particularly sugars, flours, the refined carbohydrates, getting into our blood system all at once. Now you have high blood glucose. You have insulin release to bring it back down, because high blood glucose or low blood glucose are both fatal. Your brain will die. So your brain needs a safe range, and you've got insulin at the top, adrenaline at the bottom to correct glucose levels getting out of a safe range. But after a while, the receptors that take the glucose out of the body and put it into fat, liver, and muscle cells, they wear out. We're not supposed to be bombarding them at the rate that the processed food industry is giving us these intense cravings that we're eating over. So they wear out, they slide down into the cell, and that's where you get high blood glucose all the time. And then you have the adrenals wearing out because they're constantly trying to pick up the low blood sugar. You get too much insulin at the beginning and it crashes your blood sugar, and the adrenal glands are picking it up, but they're wearing out too, adrenal fatigue. Okay, so what's happening is that with this thick blood, it's now your body is trying to push it through these little tiny capillaries, and it's breaking the capillaries. Okay, so we're going to come back to this again and again, these broken capillaries. That means that the cells around those capillaries are not getting blood flow anymore. So if you start eating real food, how does diabetes go into remission? Your glucose is stable, the insulin receptors revive, your fat receives from the pancreas, so it's able to do a better job of producing insulin. The adrenals rest and revive. Blood thickness now goes back to normal, and therefore the damage to the capillaries is reduced. It's mechanical. And the industry makes $306 billion a year in revenues from treating diabetes. So that would be devastating to the medical industry if they lost $306 billion of revenue. 11.6% of Americans had diabetes in 2021. So you can see why the medical industry is not pushing. They should be pushing just like crazy. They should be pushing pushing everywhere. They should be publishing articles. They should be teaching children. They should be everywhere, everywhere, everywhere. Every medical professional should be everywhere telling people how to get off of processed foods to put diabetes into remission. Why aren't they? Because they're making $306 billion in revenue off of diabetes, treating diabetes in the US. Okay, so I have 3 slides on each chronic illness that we're going to be talking about today. I'm not going to spend all that time on each of them, but what I would say to you is if you have this condition, stop the video, read the slide, read the 3 slides that go with that illness, and find out how to put it into remission. Okay, so like high blood pressure, stress, it's a bloodstream full of glucose. Your body has to increase pressure to push that glucose-filled blood through your body, and it disrupts your sleep, and you have loss of mobility, and all those things combine to create high blood pressure. When you get off the processed foods and your blood is no longer so thick, everything can head back to normal. But half of Americans have high blood pressure, and this generated $79 billion in revenues to the US medical industry in 2020. All right, so you're getting the hang of this. Let's look at obesity. High fructose corn syrup converts to fat 2.5 times more readily than sugar. High glucose, remember the glucose disruption? We've got high blood glucose now. It's being stored as fat. And compulsive overeating, which is the tobacco/food industry, hyperactivating cravings in your head. It means that people are overeating almost twice the number of calories they need. So, and then you've got the fatigue, the depression, you've got joint pain, and these are all barriers to exercising. But when you get off the processed foods, then you stop that overstimulation of cravings, stabilize glucose so that you're no longer having that high blood glucose stored as fat. Real food is more satisfying. Fiber content means you have stable digestion. So it just goes on and on. Obesity generates $173 billion in revenues to the medical industry, and over 80% of Americans are overweight, obese, or severely obese. Sleep disturbances, you have inflammation of airways, blood glucose crashing during the night, you have adrenal fatigue, you have caffeine use to try to counter the brain fog. The brain is inflamed, and the body, because you're not getting great sleep, is not repairing itself. And then boom, you take the processed foods out. People tell me this all the time. I'm sleeping so much better. Well, yeah, you don't have inflammation blocking your airways, and you don't have glucose crashing at night, and you're not using caffeine to try to counter the extreme fatigue. And there you go. It's mechanical. It's A plus B equals C. 17.8% of Americans have sleep problems, and this generates $95 billion of revenue to the US medical industry in 2018. So let's just go through these. I'll go through these a little bit more quickly. Heart disease, it is inflammation of the heart, artery blockage, the heart overworking to push that blood through the blood system, that thickened blood. And and also carrying weight around, carrying the fat tissue around. Get off the processed foods, those things resolve. But heart disease generated $254 billion in revenue to the medical industry. Chronic kidney disease, these are broken capillaries in the kidney. Also inflammation, infection, because the immune system is suppressed by all that cortisol, all that adrenaline, and kidney stones. When you stop using processed foods, I don't know, frankly, I didn't know about repairing broken capillaries. Everybody says you can't do it. But the inflammation will stop, and you'll stop the progression. Capillaries are not breaking anymore. Kidney disease generated $166 billion in revenue to the U.S. medical industry in 2020. 14% of Americans suffer from kidney disease. This is just outrageous. Every doctor out there should be pushing for you to get off processed foods. Liver disease, oh my gosh, high fructose corn syrup converts to liver fat. I'm going to just jump to this study. The study took high fructose corn syrup out of the diets of adolescents, and their fatty liver started clearing up within 9 days. It's an outrage that every person with fatty liver is not being told get off the processed foods. But 36% of Americans have liver disease, including fatty liver, $103 billion a year. So gut issues, of course. Now, inflammatory bowel is the name of the disease. Well, it's the processed foods creating the inflammation. And Crohn's disease also gets better, and also the pain of reflux or GERD. Get off the processed foods, things get better, but these bowel conditions create $119 billion of revenue to the medical industry. Asthma, this is swollen lungs. These are inflamed lungs. You get off the processed foods and your lungs are no longer inflamed, and so your air passageways open up. 8.2% of Americans have asthma, and it creates $56 billion a year in revenues, in 2016. Complications of fertility and maternity. Again, this is inflammation. If your reproductive system is inflamed, that means the little ducts that carry the egg and the sperm, they're inflamed. They could be blocked from that. And also the cells that create sperm and eggs, remember, they're weakened by processed foods. And the adrenal glands are not available to regulate your hormones. So getting out processed foods, this has happened a couple of times in the almost 29 years that I've been doing this, where women who really wanted to get pregnant finally got pregnant. They got off the processed foods, the inflammation, the PCOS, that's the polycystic ovarian syndrome. You're not inflaming those parts of your body anymore. But infertility generated $40 billion in revenue. Cancer and multiple sclerosis, because sugar feeds cancer cells, some cancer cells, not all. Stress produces cortisol, and cortisol suppresses immune function. And of course, you have malnutrition. So cells are not working. Cancer treatment created approximately $200 billion in revenue to the U.S. medical industry in 2020. Multiple sclerosis is much more complicated than just getting off the processed foods, but you can start. My gosh, start. I know of a case where somebody was diagnosed with multiple sclerosis. They suffered terribly for decades. And they got off of processed foods, which includes getting off of gluten. Went away. Okay, joint pain and arthritis are really big issues. It's inflammation. It's inflammation of the joint. And processed foods do deteriorate cartilage. Of course, the distribution of fat tissue might be putting pressure on joints, and the antioxidant capacity of joints is diminished. Take the processed foods out, and a lot of that resolves. I've heard this over and over and over again. People are told to just live with their joint pain. Well, you're getting old. No, it's not that you're getting old. It's that the time that you've been eating processed foods is longer and longer. People are so excited. And I want you to know this doesn't take that long for these results to start rolling in. It can be a matter of weeks. All right, 20% of American adults have some kind of arthritis or joint pain. But this created $459 billion of revenue to the U.S. medical industry. Every joint specialist out there should be screaming about processed foods. They should be asking you every time they see you, how are you doing with getting off of processed foods? But they just make more money in prescriptions and surgery. Osteoporosis, also processed foods interfere with bone mineralization. And when you get off of them, the bones can start to mineralize themselves again. Very profitable chronic disease, 200 billion. Now, this is a section that's very near and dear to my heart. And I do want you to know that I am leaning heavily on a book by Christopher Palmer. He's a psychiatrist, 25 years on the faculty of Harvard Medical School. He runs the residence education. This book, Brain Energy, is about how all brain disturbances, all mental illnesses have a common foundation, which is mitochondria dysfunction in the cells. So I am standing on really firm ground here as I go through and tie depression. Read this slide if you have depression, to processed foods, very profitable disease for the medical industry, anxiety and stress. So it's all that extra adrenaline from regulating glucose. It's one of the reasons it makes a lot of money for the medical industry. Attention deficit is because the blood flow is going back to your craving pathways instead of your thinking pathways. It's pretty widespread in the US. Alzheimer's and dementia, same issue. The blood flow is going back to the craving pathways instead of the thinking pathways. So gradually, the thinking brain cells, they're deprived of blood flow and they gradually just work less and less well. But that comes back. When the blood flow gets back to the frontal lobe, it's a very, very profitable disease, 500 billion in revenues. Okay, so stroke, these are weak cells in the walls of the arteries leading to the brain. And when you get off the processed foods and you're reducing plaque and you're normalizing blood pressure and you're nourishing blood vessels, things can get better. You might have more energy to stimulate the part of the brain that needs to be repaired. And eating disorders. So eating disorders should be treated with getting off the processed foods. I have a whole nother video, if you would like it, on why the eating disorder treatment community is pushing processed foods when they are the source. We have lots and lots of evidence that these hyperactive craving pathways are the problem, and yet these treatment centers are pushing the processed foods that create the activation. So have some hope there. Reach out to me if you like, info@processedfoodaddiction.com, and I'll get you that video about eating disorders. So this is something I'm not going to dwell here, but I would encourage you to read these slides. In the first few weeks of getting off of processed foods, things are happening. Glucose is stabilizing, inflammation is going down, cells are no longer under attack, adrenaline is normalizing, and you can feel it. For me, I felt it at the end of 4 days. Brain fog lifted because my brain wasn't inflamed anymore, and the bloating stopped because I wasn't putting toxic substances in my gut, and my energy came up, and I just was so excited, and it just rolls out and out and out. But I don't want you to go through this experience and think that something else might be causing these benefits. It's getting off of the processed foods. And then by week 4, your pleasure pathways in the brain are now opening up again. They're not worn out. They're not exhausted all the time. And your blood flow is returning to the frontal lobe, so you're thinking more clearly. Inflammation is going down. So all kinds of disease markers can be getting better. One thing I will say to you, and please do listen to this part, if you are taking medication for anything, get checked out regularly. Find out from your doctor how to adjust your medications. If you say to them, if the underlying problem goes away, if my glucose is normal, if my blood pressure is normal, if my heart rate is normal, how do I adjust my medications? So thank you. Okay, get lots of skills. I'm not going to go through this whole list, but we teach all these skills. It does take skill to escape the processed food industry. It just does. They're very, very good at what they do. All right, so this is my word. Stop existing as a human profit center. Right now, between the food industry and the medical industry and the weight loss industry, we're just human profit centers. And start flourishing as a happy human being. And I will say that if you are interested in workplace wellness, or if you are interested in getting help for yourself, we are the only outfit that really understands how these chronic diseases are connected. We know that workplaces are paying a lot of money out, and individuals are paying a lot of copays out to get these diseases treated. So you can save a lot of money by putting them into remission yourself. Real Workplace Wellness, you can find us at realworkplacewellness.com. Or please email me, Joan Ifland at remissionoptimistic.com, and I will make sure that you get the help that you deserve. Thanks so much for visiting with me today. I am just so happy that now you know there is a pathway out of many common, painful chronic diseases. I'll see you on the other side.